the last 7 years, I've heard like a whooshing noise that goes to the sound of my heartbeat in my ear. They told me it's TMJ because I keep clenching my jaw and grinding my teeth when I sleep. But also, the whooshing noise, he thinks it's an aneurysm.
I'm Dr. A GP based in the UK, so should you be worried about hearing a pulsing sound in your ear? The medical term for this is pulsatile tinnitus. So pulsatile tinnitus is almost like a rhythmical sound that you can hear in both your ears, and it's in timing with your own heartbeat. Now normally this is due to a change in blood flow or a change in awareness of the blood flow of the small blood vessels inside your ear. If you've got this is something you definitely need to bring up with your doctor. And when you see us, we'll probably do an initial physical examination, which will include listening to your heartbeat and listening to the blood vessels in your neck. May also refer you for a hearing test. Most people will also need some further investigations, initially blood tests, because there are some things that can cause this, like a low vitamin B12, low iron. We may also refer you for some imaging. This can include an MRI angiography, a CT scan, or an ultrasound scan. This brings me on to what can cause pulsatile tinnitus, and as I mentioned, it's down to a change in blood flow in the small blood vessels inside your ear. This can happen if there's an increase in blood flow. Things that can do this are severe exercise, pregnancy, overactive thyroid, or anemia. Now sometimes the blood flow can become more turbulent. Most common causes for this are things like aneurysms and atherosclerosis. This is narrowing of the arteries. You can also get something called localized increased blood flow, which means a particular blood vessel has an increased blood supply to it. This most often is down to a tumour. Now it's important to know most tumours associated with pulsatile tinnitus are benign. A very common reason for this is something called altered awareness, which means the blood flow hasn't changed, you're just more aware of the pulsatile tinnitus. Now the most common reason for this is actually hearing loss, and that's because you become less aware of your surrounding noises and the pulsatile tinnitus becomes more obvious to you. Despite all that, there's still lots more causes for it as well, and like I said, most of the time it's completely benign and nothing to worry about, but it's definitely something you want to get checked out, especially if it's something new or you've never got checked out before or is getting worse.